Senator Smith.
Thank you, Chair Sanders, for holding this hearing, and thanks to all of you for being with us today. I was just thinking about what you were saying, Dr. El Sayed, at the beginning about how what's causing medical debt is the high cost of care and then the poor insurance coverage, and constantly people are finding some new thing that they are supposed to pay for that they didn't know that they were supposed to pay for. And just to be clear, my view of it is that healthcare should be a human right, and your opportunity to get the healthcare that you need shouldn't depend on who you are or where you live or how much money that you have. And I do agree that the solution should be universal healthcare. My question, so this is where I want to go with my questions, because I think that since that is not the world that we live in right now, I'm very interested in trying to get at how much this damn stuff costs. And I just want to say I'm glad Senator Cassidy is here, because Senator Cassidy and others of us did really important work on getting at the surprise medical bill and people finding suddenly there's a surprise and they were a cost that they weren't expecting, and how that shouldn't be borne by patients in that transaction. I'm also really interested in a bit of what Senator Budd was getting at, which is there is so little transparency for people who are seeking health care to know how much things cost. It's of course one thing if you find yourself in an emergency room with an urgent need and you don't really have any choice. But if you're trying to, say, for example, do a do a knee replacement or a hip replacement, it's almost impossible to figure out what the actual cost is, or how much you would pay if you went to this place, place A versus place B. Now, CMS, in January of 2023, the Biden administration put out rules requiring hospitals to post upfront prices, but the compliance with that is very low. I'm very interested in the bill that Senator Braun and Senator Sanders have worked on, the Healthcare Price Transparency Act, which I think would help to get at some of this issue, requiring some easily understandable way for people to understand how much things are costing so that they can make educated decisions. I wonder if Dr. Messick or Dr. El Sayed, if you would be interested in just commenting on this and what you've seen in your practice about the challenges of knowing, basically how to be a good selector when you're trying to figure out how much stuff costs.
Let me first speak from a policy level, and I'm going to answer this question in an interesting way. I love Costco. And one of the reasons I love Costco is because Costco has a policy where their markup is not going to be greater than 15% the cost of the actual good.
Right.
Part of the issue is that our costs are non-transparent, so they hit people in some really profound ways, and they hit them when they're hurt the most, literally insult to injury. But the other part of it is also what those costs are. And we don't really have a way, to your point, about assessing why the Advil you got in the hospital was so much more expensive than the Advil you got at Costco. And if we're serious about addressing this issue, we really do need to be thinking about the ways that prices grow. The second thing I want to say about this is just that it's not only that we have the highest prices and the fastest growing prices in the world, it's that we have the highest overhead for healthcare in the world. And a lot of that is about billing complexity. Right. It's about all of the billers that you have to hire on either side of a financial transaction that allow that transaction to happen because we have such multiplicity in our system of both providers and payers. The provider side is great. You get to pick which provider you go to. But when it comes to that many payers, each of them with an army of billers, it creates a real problem.
Yep, that's right. Dr. Messick, and I just want to say, I have talked to hospitals who tell me the extensive amount of money that they have to invest in getting the insurance companies to actually pay for the stuff that they're supposed to be covering. And that adds cost to the whole system as well. But Dr. Messick.
Yeah, thank you, Senator. I think price transparency is a good step. Taken by itself, it would do some good. I know a lot of my patients also often ask how much things will cost, and I can't answer their question because I don't know myself, and it's a big source of concern. I do worry, being in the emergency room, like you said, that patients come to me delirious, sometimes unconscious, and they have no choice in where they end up. And the last thing I want my patient with a stroke or a heart attack to do is start shopping around and looking at which would be the cheapest place to get their emergent procedure done. I want them to show up as close as possible, as quickly as possible. So I do worry that if we marry this with high deductible health plans, as has been done in
That's
the
right.
past, that we're not going to solve the problem.
Price transparency doesn't solve the problem of high deductible insurance plans, and it doesn't solve the problem of people who are in a crisis situation and are, so it is not a solution to all problems. But I do think in the short term, it is a way of trying to get some accountability in a system where, I mean, even sometimes within the same institution, you might have very different prices for the exact same procedure, just depending on whether you have, what insurance you have, or whether you're paying cash, which might actually be the cheapest way of paying for your procedure. I'm out of time. Thank you. Thank you, Chair Sanders.
Senator Murphy.